Good evening, dear friends. Well, finally, we have reached the main muscle of our human body. The heart, friends, is not just a mindless pump that circulates blood, but it's also the organ of love and the repository of the soul, dear friends. Therefore, our task is to create the most ideal conditions in which our heart works. That's why we have to create them for it. So, friends, as you know, according to the latest research by British scientists, our heart is located inside the chest cavity, just like the lungs. The condition of the heart depends directly on the diaphragm, on the mobility of the chest cavity, which is prone to losing this mobility. And the worse its mobility, the greater the load on the heart, the harder it is for it to work. So, what do you think? Write in the comments, in what position is it more comfortable for the heart to work? Like this? Or like this? What do you think? Well, answer this question. Let's see how many correct answers there will be. Well, it's clear that the denser the chest tissue, the worse the rib mobility, the harder the heart works. The intrathoracic pressure increases. The intra-abdominal pressure increases. The diaphragm mobility is limited. It becomes harder for venous blood to return to the heart. More pressure needs to be created by the heart itself, the aorta, in order to push blood throughout the body, so that it reaches all our vessels, all our capillaries. So, friends, now we will start creating ideal conditions for the heart to work so that it could work continuously for at least 30 years. And then after this exercise, you'll get 130 more years. So, friends, we start with you with such an exercise. It will consist of two parts for us. First, we will increase the mobility of the chest by acting on the muscles, on the ribs themselves, on the intercostal muscles, on the parts where the ribs connect with the sternum. See here, the cartilaginous part of the ribs also loses mobility over time and even ossifies. No mobility remains here. We will increase the mobility of your diaphragm, make it more elastic. Because when the diaphragm loses its mobility, loses elasticity, this is not only bad for the heart, but also for the abdominal organs. And so we will have such a multi-effect. And, of course, special exercises that not only increase the mobility and rib cage, but also directly positively affect the work of the heart, facilitate its work, and at the same time train as necessary. And also the reflex effect on the heart, which improves the blood supply to the heart muscle itself through reflex action. The blood supply to the heart itself increases. So we are also preventing heart attacks. So, friends, first thing we're going to do is to remove all the painful points here on the sides of the chest, between the ribs, these gaps here. We need to find the painful areas. Here we have the sternum in the middle, the ribs, and we need to find these gaps with you. And we find the painful areas. First, just go over them with your hands, and there will be more painful places like this. They can be asymmetrical. There can be more pain on one side than the other. And you need to work through all these areas. That is, you can do this with your thumb, you can do it with other fingers. You can do it simultaneously from both sides if it's convenient. And so, in this way, we found the sore spot, pressed on it, and hold it for 10 to 15 seconds. Then move on to the next one. You can do this in motion. That is, you can press and hold, and you can move a little, like this right-left. And so in this way, your task is that. There may be more painful places. Where there is more pain, these are the problem areas that affect, among other things, the circulation of blood in the heart itself. By acting on these places, you will improve the blood supply and the heart muscle itself and ease its work. Because a heart attack is associated with the fact that the blood supply to the heart muscle itself is disrupted. So work out every painful area. Where there is more pain, there you massage a little longer. On average, each of these points needs to be massaged for about 30 seconds. The next step is, we will work on the diaphragm. We start with this part right here, between the xiphoid process of the sternum and the rib. You also need to find such a part. It is often sore. It is located here. And you also press and hold it. Hold it for about 20 to 30 seconds on one side and on the other side. In this way, you relax the diaphragm by acting on this part. Blood flow occurs, lymph drainage from the diaphragm improves. If there are any stagnant processes, they all get activated. The condition of the blood and lymphatic system improves in this area, in the area of the diaphragm itself. Then you start to look for these sore parts along the ribs, and also work them out right along the ribs. Here, first, you worked out these 2 points from one side, and then from the other side too. Press and hold. Find the most painful parts. Next, you do this along the ribs, here. First, you need to work out this entire zone along the rib itself, right and left. Remove all the sore points that are there. It will take you about 2 or 3 days, and then you can already act here, under the rib itself. That is, with your fingers you can get under the rib here. And thus you act directly on the diaphragm itself. You see, you do it here. Get your fingers in here. You can do this sitting or lying down. Lying down is even more comfortable the first time, especially if the diaphragm is very tense, so it is better to do it lying down since the pain will be less. It will also be sore. So you find a sore spot and hold it for about 10-15 seconds, but no more than 30 seconds. From one side and from the other side, there may be uneven pain, both on the right and on the left. Where you feel more pain, there you stay longer. And you work it out like this, from the inside. You should touch the rib as if from the inside. Here, touch it along its entire length. And so, after we did this with you, we improved the blood flow to the heart itself and slightly relaxed the diaphragm. Now we proceed to the very exercise that will restore the mobility of our rib cage and directly affect the heart, improving blood flow to the heart. In this way, we will train the heart muscle with you. For this exercise, we will need an orange towel. We will use it throughout the entire exercise. Not like this, but like that. You take it in your hands, lie down on the floor. You can do this exercise on the floor. Stretch out like this, hands forward like this. And now raise one hand, but at the same time keep a little tension of the towel. Raise it and then lower it. The second hand should be on the floor. So you hold it with one hand, leaning on the floor, and raise your second hand. You can do it on one side first. Repeat it about 10 times. In this exercise, the spine also strongly strains. And now move on to the other side. Then alternately raise it from one side to the other side. The head can also be turned, or you can look straight constantly. You can look down. In general, look where you want to look. The main thing is that your hand is high enough, raised from one side and from the other side. That's the exercise, friends. Try it. After this, we get up on our feet and immediately feel that the load from here goes away. It becomes much easier to breathe for the rib cage. And here you will feel such freshness in the area of the heart, diaphragm, because a new blood flow arises. And in such a sequence, all this needs to be done. First, you need to work on the intercostal spaces, then work on the diaphragm, and then this movement will slightly load the back muscles, increasing mobility in the chest cavity. All of this combined has such an effect. For those who find this exercise difficult but still want to improve their heart's life, improve the condition of their heart. For those of you, there is a simplified version. See, I care about you too. Go up to the wall like this. Put our hands up, stretch out the towel, and we do the same thing, but around the wall. You see, back here, we make a movement like this. Everything will get stretched here for you. The mobility of the ribs, rib cage, and breathing, by the way. This exercise also affects breathing because it is much easier to breathe in the oxygen, breathe out the carbon dioxide. So, that's a simplified version. For those who found the previous one difficult, try this. Well, friends, you feel it, right? How your heart already beats in the same rhythm, in unison with all subscribers. They all simultaneously beat the heart rhythm. Well, friends, write in the comments your impression of your updated heart. You now feel as if there is actually a soul inside your heart, and it's already rejoicing. Or not. Anyway, in general, write comments, subscribe, like the video, do sports, help your parents. Until the new broadcasts.